All right. Well, we're just a minute after the hour, but I think let's go ahead and get started. I believe this webinar is being recorded, so we'll be sharing real time and also make it available to folks after the webinar. But welcome everybody. We're really excited to have you here. My name is Evan Schmidt. I'm the CEO of Valley Vision, and we're going to be going through the findings of the 2026 Economic Mobility Poll, and we'll be able to talk with some experts from the field about the topics that we've covered within that poll. Before we get into the specifics of the poll, I'd love to just talk a little bit about the polling initiative overall. So Valley Vision has been partnering with Sac State Institute for Social Research to do public opinion polling in the region since 2016. This has been an important component of Valley Vision's outreach and engagement strategy for the region because having this polling mechanism enables us to do a status check-in on what are the experiences and perspectives of folks from the region on pressing issues that happen throughout our communities. And so today we're going to talk about our economic mobility poll, but we've polled on a number of different topics over the years, including a semi-annual livability poll that we do. We've polled on environmental issues, the built environment. We've done economic security. We've done food security. We've done civic amenities. So a number of different topics in order to really explore quality of life and experiences of people in the capital region. So today's poll is on economic mobility. And this work really comes from a multi-year initiative that Valley Vision has been leading. It's a program of California Jobs First, which is a statewide program. Our regional effort is called We Prosper Together. And We Prosper Together has been a planning, capacity, and implementation effort around inclusive economic development. It started with a lot of community engagement and a lot of quantitative data collection to look at where our challenges and where our opportunities for economic mobility and growth in the capital region. And through the community engagement that we did, there was a number of issues that came up repeatedly, and were the most frequent issues that came up that were factors that impacted people's ability to find economic opportunity and be socially mobile in their lives. And so these issues are housing affordability, transportation access, childcare availability, and career opportunities. And so we wanted to take these topics and do this regional poll in order to understand more about people's experiences and perspectives and get a regional look at how these economic mobility issues are impacting people's lives. And so that's what this poll is doing. And we're going to go through some of the high-level findings across all these topics today. And I'm going to turn it over to Chloe Pan to talk more about the specific methodology of the poll, as well as the specific findings of the poll. So Chloe, take it away.
Thanks, Evan. Hi, I'm Chloe Pan. I'm a project manager at Valley Vision. So to give a brief overview of our methodology here, so we partnered with SACOG and the Institute for Social Research at Sac State to do this poll. So many thanks to those teams for their continued partnership. This poll was specifically administered to residents in our 6-county region. So that's Sacramento, El Dorado, Placer, Sutter, Yolo, and Yuba counties. And it was in the field between September and October 2025. We had 1,118 residents respond. And as with all of our public opinion polling, our results are weighted to be demographically representative of each of our counties in our region. Examples of these demographics include, the county they come from, race, gender, household income, that sort of thing. The top line findings of this poll has a margin of error of plus or minus 2.9%. And with that, we can go into our poll findings. Thanks, Adrian. We'll start with childcare availability. We found that residents with lower incomes were more likely to say that they left their jobs or decided not to attend school because of their unpaid caregiving responsibilities compared to residents from households with higher incomes. So again, with the barriers to economic mobility, this is just one of those topics where we wanted to see the difference between household incomes, how that connects with people's accessibility of workforce opportunities. So specifically, 67% of respondents making less than 50K a year said that they left their job for this reason, compared to 12% of respondents from households making between 100 to 200K. So that's a pretty big jump right there. Our second top line finding, we found that the high cost of childcare has caused 1 in 6, or 17% of primary caregivers in our region to drop out of the workforce. And they specifically said that they aren't currently working in order to care for their child or children because childcare is just too expensive for them. And lastly, we asked residents if they received any childcare benefits from their employer. So, benefits like health care for their children, a flexible work schedule so they could take care of their children, adequate PTO, paid parental leave. And among all of the respondents, only 22% or 1 in 5 primary caregivers said they didn't receive any of these benefits. Next slide, please. So here's just a visual representation of that first finding we were talking about, that big difference of respondents by income level who reported needing to leave their job because of that unpaid care burden. So it goes from 67% of folks making up to 50K leaving their job down to 12% as their income increases. Next slide, please. And then this is that similar question, but for folks who left school as a result of their unpaid caregiving responsibility. So again, a jump from 47% of folks with incomes less than 50K down to 5% for folks making 100 to 200K a year. And so we just wanted to also give some additional context to our findings. So here's additional research on the caregiving topic. So in particular, noting that women of color in lower income households tend to shoulder this burden of unpaid care, restricting their ability to participate in the workforce. As a result of the lack of accessible and affordable childcare, there's an estimated loss of $216 to $329 billion in economic productivity in the country. In Sacramento County alone, this is an estimated $1.2 billion in economic losses annually. Next, mothers with young children are also more likely to report having had to miss work because of childcare challenges in comparison to fathers. So there's also that impact of traditional gender roles that often expect women to be responsible for childcare, but may negatively impact women's workforce participation. And lastly, research from Oxfam on caregiving in the United States found that Black and Hispanic women in the United States demonstrate higher involvement in unpaid caregiving than any other racial and ethnic subgroups, as well as in comparison to men. So the intersection of gender, race, and ethnicity bring complex challenges for economic equity. With that, I will introduce our first speaker. Next slide, please. Who is Erin Manley from Child Action. Erin is the Director of Research and Data at Child Action and leads their data strategy to inform decision-making, strengthen programs, and highlight the critical role of childcare in supporting families and the regional economy. Thanks for joining us, Erin.
Thank you, Chloe. Thanks so much for having me.
So I know you've been doing this work a long time. As I presented some of our findings from this poll, was there anything that stuck out to you? Was there anything surprising?
Well, all the information is information Child Action cares about, pays attention to, we're looking at, we're studying as well. It is exactly the work that we do. I'm always surprised though at the disparity of pay between childcare providers caring for and educating children between the ages of 0 to 5 compared to teachers who are in the education workforce. So that 1 out of 6 caregivers are leaving the workforce due to cost is what surprises me most out of the poll today. This is part of the work we're actually doing in a local cost modeling cohort is finding a local true cost of care so that we are finding more parity with that equity lens for child care provider pay. And I think there's some old school thinking that childcare is a parent issue and this is a family problem. This is not a family issue. It is a workforce and economic issue, and it's structurally embedded into what we're doing today. And so while it is what stands out to me the most, it's also what we keep trying to work at every day. So it's surprising, not surprising.
Yeah, thanks so much, Erin. And speaking of those, structural issues, another question we've been asking folks too, but especially, would love to hear your thoughts. Do you have any recommendations for maybe policymakers to address, some of these gaps?
Sure, sure. In general, I think we've designed a system where we determine who deserves access before we've ensured access can even exist. Another stat, and I apologize, I'm bringing in another stat, but only 1 in 5 eligible children receive services here in Sacramento County. That we've seen that get a little better. I think in the whole state, it's 1 in 6. So we do a little better here in Sacramento County. But again, when we develop a system of eligibility without funding the full cost of eligibility, these are the rates that we see. We see 20% of children actually getting what they need. And to top that off, 1 out of 6 caregivers leaving. This tells me we have a system capacity failure. And so what I might recommend to policymakers is if we treated childcare the way that we treat TK-12 education, and I get we have multiple funding streams. We have a mixed delivery system, a lot of parent choice in the system, but we don't treat it like it's an economic infrastructure, like it's early childhood education. But if we treated it as an infrastructure, our policy design would look fundamentally different. I keep thinking and wondering, all kindergartners are eligible for kindergarten. Why wouldn't all 0 to 5 year olds be eligible for the high quality childcare that their families need?
Thanks, Erin. As some of you may know, Valley Vision has been leading the statewide cohort around the ECE sector, and Child Action is a member of that. We've been talking about what the next 5 years might look like and exciting developments around ECE policy. New Mexico became the first state to offer universal no-cost childcare towards the end of last year. Do you have any predictions if that may be a possibility in the state, or yeah, what do you think the future of the sector kind of looks like?
Absolutely. And this question gets me excited because it's like, okay, we are moving forward on making some changes. Over the next 5 years, I think we'll see childcare move from being treated as that social service to being treated as that core economic infrastructure. And I'll talk about that a little bit more in a second. Um, Child Action is also experiencing digital transformation. We are hooking into faster systems, faster data. I see more real-time data and automated processes very soon, which means faster decisions and faster services to our families. I see, and we just hosted a webinar yesterday and talked about our business sector. But I think too, businesses are going to get more involved understanding the supply and demand economics of childcare and investing in those solutions because they will want to be hiring parents and they want parents to show up. And so I see businesses also investing more. And more cities working locally to build childcare capacity in their concentrated areas of high need in their cities, and developers considering childcare spaces when they're developing and their city planning. And it's really about why we're all here in the spirit of partnership is considering the funding for all the wraparound services such as housing, transportation, food, and education programs. And education is including AI, absolutely. So it's interwrapping that, interconnecting all of that in the way that we start to see families and children and the workforce as one. And so I'm super excited about the next 5 years and where we'll go with childcare.
Thanks so much, Erin. I really appreciate those insights. Can't wait to dig in more in our Q&A portion. But with that, I think we'll now turn to our findings regarding AI. If Adrian, you can bring the slides up again. Thank you so much. So, as more companies adopt the use of artificial intelligence, we wanted to survey respondents as well to see how AI is impacting our workforce in our region, and to see how often residents are using AI in their daily work, if employers are instituting policies and guidance on AI usage, if we're all ready for, the steamrolling of AI being introduced across different work streams. So the findings can help us understand if employers are responding to this rapidly changing landscape and if they're being prepared for its integration. So some of our key findings, we asked respondents how often they use AI for tasks at work, and 47%, so nearly half of residents right now, say that they rarely or never use AI at work. 33% said that they use it a few times a month, and we found that people with lower household incomes who are aged 65 plus as well were more likely to say that they never used AI compared to higher income and younger respondents. We also asked people if their employer has provided guidance, policies, or rules on how to use AI at work, as well as if they provided any trainings. 64% said that they hadn't received any AI guidance or policies, and 78%, so even higher, said that their employer hadn't provided any training on using AI for work tasks. We then asked people if their employer allowed them to use AI for work, and we found that 58% said that their employer allowed them to use AI at work, despite many not providing those policies or training on the usage. So if we can go to the next slide. This is just a graph showing employers' perspectives on using AI, their allowance of it. So going from you are required to use it on the left side all the way to you are not allowed to use it. We see that the most common response is that 58% employees are allowed to choose when to use AI for work tasks. And then the next most common response was 21% of respondents saying that they aren't allowed to use it at all. So with that, I will now introduce our next speaker, Alan. Alan provides technical services regionally, including computer-aided drafting CAD, 3D modeling, and mechanical design and application development. He's also taught at Sierra College, Sac State, and Folsom Lake College. Thanks for joining us, Alan.
Thanks for having me.
So as I read out some of the findings from the poll, does that sort of resonate with what you're seeing in the sector?
It actually surprised me a little bit because with what I see, it's so hard to separate the glitz and glamour from what's actually going on. So I think when you think about, everybody's heard of like ChatGPT and Claude Code and things like that. Me personally, I'm kind of an old school engineer, so I still like pen and paper and stuff like that. But I appreciate the tools. But I guess it resonates with what I would expect, I guess is the best thing. I was actually expecting it to be a little bit higher because depending on who you listen to when you talk about AI, it's like this whole like I think FOMO is what the kids call it, or maybe I'm no, that's what I call it anyway. But yeah, this whole fear of missing out when it comes to like AI. So it's in line with what I expect, and if anything, like it makes me kind of again like which I'm sure will come up with other stuff. It's kind of like the buzz that kind of surrounds it. So.
Yeah, thank you. And then just speaking from, yeah, your perspective in the work that you do you have recommendations for how employers can be providing additional training or guidance? Do you feel like that is something
Well,
that's key?
I don't think it's a one size fits all approach. I think the best way I can think about it is I'll just lean on engineering, I guess, as the. I think sometimes people get caught up between technology issues and process issues. So when you think about like teaching and stuff like that, we want to get kids like the best computers and all this other stuff like that. But there's underlying lessons there, and so now in some point, with AI of that, we're going back to handwriting and things like that. So I don't think it's a question, and I think when you talk to a lot of AI proponents, they like, "Oh, you're missing out." But it's a question of what the situation requires. And for me personally, I think it's more like AI is a tool. I was talking with my uncle, and he said, and he has this awesome way. He's retired, 35 years, Boeing, worked in the missile plant, and he says to me, I love talking to him when he says, "So what it sounds like to me is basically just a faster computer," and I was like. I can't disagree with you. But yeah, it's more of what is the benefit this brings? I kind of think about not to get a little bit well, not dirty here, but I think about South Park and the underpants gnomes when it's like stage one collect underpants, stage two is blank, stage three is profit. But it's a question of really like actually saying what the value is and just not leave vaporous statements in there. I think there are situations where it's absolutely useful, and as much as I talk about it, there are things where it helps me out as well. But it's not a situation of like you have to use AI. It's just having the maturity to ask the question is what is the actual benefit of this?
Yeah, thank you. That's really important. And I think, speaking to some of the fears maybe that I've heard from folks is this worry that jobs may be eliminated as a result of AI kind of expanded usage. Do you foresee that being an issue in your work or in the design space in general?
Absolutely. Because one of the things that I believe is if they can, they will. And again, I think of Mark Twain who said, "History doesn't repeat, but it does rhyme." Right. And the thing is that it's kind of like, I'm not gonna guess the ages here, but 20 years ago when I was an undergrad in high school, the big thing was like internet searching and Google and stuff like that, and like verifying information. So it just kind of changes where it is. But when you think about the age-old thing about capital versus labor, you have all these situations of like, if they can do the same thing and make less or pay less or spend less, then they're going to do that, which is why things like this are so important because a lot of and I don't want to seem like I'm all like everybody wants to go like oh AI stuff like that, but one of the things that kills me about a lot of the technologists that we get up there talking about, like Altman, Musk, Bezos, and all this other stuff like that, they talk about how we're doing these things like for the good of humanity, but no, it's you're doing it for your pocket. So just say that. So, and which is why it's important to do things like this because at the end of the day, like it or not, it is government, it's public organization to do that because it's just the person. It's funny how the solution to all of your problems is this $20 a month subscription to whatever. But it is useful though. But I do see that a problem. It's just like foreign workers. It's the same story and a different thing. If they can do it cheaper, they will do it cheaper. So it kind of just goes back to like what that why do unions exist to provide your thing. So it just comes back to the skills that we provide, but it shifts. But I absolutely do see that as an issue.
Yeah, thank you. And then maybe if we can talk about the brighter side of things.
Okay.
Do you have any?
Yes, 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 yes. I do. I do. Actually, and thank you so much for asking that because I have a lot of people, in the spaces that I run in. I have some friends of mine that are very passionate about AI, and it's kind of like arguing on the internet, right? So it's like if I say, I love pancakes. And then, like, I get a message in my inbox, why you hate waffles? I ain't said nothing about waffles. And so, when you talk about AI like that, I get that. But the positives, at the end of the day, it's and we could talk about the environmental constraints, all that stuff like that. But I think it's the specific applications like medical imaging, like just chunking through all this data. We have medical imaging. We have pretty much anything like processing, like the coding stuff is kind of nice. I've used ChatGPT on numerous things, and it was kind of funny because a while ago, I had someone say you should use ChatGPT, and I was like, "Rah, rah, rah," and I used it, and I was like, oh, this is helpful. Gemini, as it integrates into Google search, is incredibly helpful for me as someone who codes and things like that. So it's more like when you have the best hammer in the world, everything looks like a nail. So I think it's a fantastic tool. I think it has the potential to do so much, even in my fields. But I think it's just that idea of like, we're going to go to a perfectly fine working process. I'm going to extract value for myself and then tell you I did something. So it's like why does the post office not turn a profit? Because it's not supposed to. So if you're talking to me about efficiency with a public organization, I'm gonna look at you kind of crazy. So that's kind of how I feel with it. But no, there are absolutely benefits. We're doing amazing things with it. But do we need to cram it in every shoehorn in every corner of it? And people know that too. It's like the Luddite. We have all these things about technology coming in, like the Luddites who were like smashing looms and stuff like that. So the thing that I like to say from all of this is that this isn't a new thing. It's just the current manifestation of something that I think has existed as long as humans as we've existed in groups.
Yeah, thank you, definitely. And then maybe last question on the workforce training side, since you've done a lot of teaching as well. have you seen AI being integrated more fully and being embraced by, maybe younger generations or folks going through these classes?
Yes, and to be fair, it hasn't all been bad. Because so I teach programming with high school kids, and I've been doing it probably 4 or 5 years now. I do it over Zoom and stuff like that. And so I give them stuff, and again, my objective is because like, and these kids are so earnest. One of the kid tells me, he says, "Oh, I put the I gave it an AI and it didn't work." And I'm sitting there like, why would you tell me that? But then I'm like, okay, whatever, we'll roll with this. And I'm like, guess you'll have to think about it now, right? So I like finding situations to create that. But on the flip side, actually last semester I was working with a student and he actually threw what I gave him at an AI. And while it didn't give him the full answer, it did give that link to be like, look here, and he eventually got it. So it all comes back to the fundamentals. I mean, you can't like these tools take time to use effectively, and people focus too much on the outcomes. I mean, you got to eat your vegetables. You got to, if you want to write a story, you need to learn the alphabet. Like, you can't skip that part about it. And the lessons you skip are you're doomed to repeat until you learn them. And like just with so much stuff with tech, the AWS outage where you had the 8 sleeps beds weren't working. I think the Pocket OS is a new story where an AI coding agent deleted their entire database. This isn't a technology issue. This is a process issue. How do we work? How are these tools integrated? Too many people now, as I see it, are conflating the two.
Thanks so much, Alan. I really appreciate your diverse, balanced perspectives on this
Thank you.
topic.
Yeah, yeah. Like it's good. There are good things. There are lots of good things.
Definitely. Okay, so I will now turn to our housing and transportation findings. Thank you, Adrian, for slides. We're going to lump these two a little bit together because we have our guest speaker speaking on both. So first is attainable and affordable housing. So I don't think this will surprise us, but similar to what we saw in our most recent livability poll, housing affordability is still ranked as critically important by 70% of residents for our community to improve. 52% of respondents across the region also said that building more housing to address the region's housing shortage was very or extremely important. And 53% of respondents said it was very extremely important to build more housing choices, like duplexes, like apartments, to address housing needs for folks who choose not to purchase a single family home or can't afford to. So as we know, building this missing middle housing is more affordable to produce than these larger apartment complexes. So it's a possible solution to increase more affordable housing supply. Next slide, please. Oh, Adrian, is it going?
Should say a connected and safe transportation system, but let me know if it
Oh,
doesn't.
next slide, please. There it is. Thank you. So this just shows the difference of residents' transportation priorities that we provided them to rank. So the topmost was safe streets for kids to walk and bike to school. That was their top priority. The second highest ranked one was improving road safety for all users. And so we thought it was important to see oh, sorry, I definitely skipped a slide. That's okay. Important to see the priority for safety. So that is our top finding. The next finding was that residents expressed this need for funding to support local streets and roads. So 82% said that there was this need for additional funds. And then lastly, more funding is needed to expand public transportation. And just a reminder from our 2023 built environment poll, the vast majority of residents use their personal vehicles to commute to work. So, and they say that it is because public transit is inconvenient and inaccessible. So if we were able to increase that investment, we would also increase that usage of public transit. So yeah, these are residents' transportation priorities. Again, the topmost were the safety issue. The least commonly selected priority was building new roads and widening highways at 46% of folks who said that this was important. Next slide, please. So this is just to give some context into the road safety issue that we identified. the recent data show that the rate of traffic fatalities has increased over the last decade in our region. The rate of serious collisions in our region exceed the state average by about 25%. And it also occurs more often in lower income neighborhoods. And lastly, we've also seen this increase in the number of young children visiting the ER in Sacramento County as a result of vehicle crash injuries in recent years. So with that, I would like to introduce our next speaker, Becky Johnson from SACOG, who will speak more about these findings. So Becky serves as the Director of Data Analysis, Data and Analysis. She has extensive experience leading teams where reliable and actionable data protect people and infrastructure and inform plans and decisions. Thanks, Becky, for joining us.
Thanks for having me.
So again, we've worked very closely with SACOG over the years, and especially with this poll here. So you've definitely been in all of this data as well. Was there anything surprising from the poll related to the work you do?
I would say it's less surprising and more validating. What stood out in the poll is clearly how the responses aligned around the topics of affordability, safety, and making better use of what we already have, not necessarily doing a whole lot of brand new projects, but what can we do with what's already in place? And this mirrors exactly what we heard from residents all throughout our region during our Blueprint outreach over the course of a few years as we're putting together Blueprint 2025, which is our long-range plan. And I have a couple stats in front of me for that. So over the course of a few years, SACOG embarked on with 69 regional representatives. We had developed environment polls surveying 3,000 residents. We had a blueprint survey with more than 2,700 responses. We had regional workshops with 300 elected officials, public agency staff, community leaders, local tour. We engaged with the region in a very meaningful way to develop this long-range plan. And guess what? Everybody was saying the same thing that the Valley Vision poll had to say, which is a vast majority of people are saying that improving housing affordability is very or extremely important. People want to fix it first when it comes to our transportation infrastructure. Strong priorities, safe streets, sidewalks, trails, so people can walk safely to get to where they're going, repairing existing roads and improving safety. So there weren't really any surprises. It was incredibly validating for all the good work that has gone into the Blueprint process. And for those not familiar with the Blueprint, go ahead and log on to the SACOG website and you can read as much or as little as you want to about it as far as what went into it and what the plans are, what our projections are. We are in the fastest growing region in California. Our region is 22 cities and 6 counties, and we're expected to grow almost 25% over the next 25 years. We had some recent news come out where we did some analysis on the 2024 American Community Survey census data showing that home ownership is reaching highest rates in nearly 40 years, which is great news. So even with housing costs that have increased, home ownership rates, meaning owner occupied, has increased in the Sacramento region, and they continue to inch upward. And it's the highest observed in the series dating back to 1980, which is great news. We still have problems. We still have issues to address when it comes to affordability. But people are open to ideas of how we go about addressing that. So that means enabling a wider range of housing types in existing communities, that missing middle, Chloe, that you mentioned, apartments, mixed-use redevelopment, pairing housing with infrastructure upgrades in some of the older neighborhoods. And that way homes can actually be built without driving costs higher or as higher. And then treating infill and redevelopment as affordability strategies and not just simply related to planning goals. And we do have a lot of, last year, 2024 represented a near 2-decade high in new housing construction, but we're not going to be able to keep pace with the growth forecasts that we're seeing.
Yeah, thanks, Becky. Yeah, I have noted that we definitely need to increase the rate at which we're building that housing to fill that gap. But we've also seen in our past reports that residents have some mixed feelings, right, about where housing is built, how it's being built, what our communities end up looking like. Do you have
Sure.
recommendations for local policymakers, city governments on how to address this gap and also maybe bring on board communities in greater density for development?
A big part of what we need to do is continue to work together more. So the public priorities are already aligned with what's in the blueprint. So the question is how we do it and then how we pay for it. So it is on that housing choice and also looking at some innovative solutions. SACOG recently received a grant from HealthNet on some housing. There was a development for the San Juan apartments, and they were almost there with what they needed for funding. And HealthNet was able to come in and fill in that gap with what they needed because they were able to see the connection between healthcare and stable housing. And mental health is affected by unstable housing, chronic disease, child development. Children in stable housing experience better academic achievements and have fewer behavioral and mental health problems. So HealthNet was able to see that benefit. Same thing out in the Yuba Sutter area, Adventist Health making some investment improvements into safer walking and biking access for some of their existing communities. I didn't get to touch on transportation when I first opened up. I honed in so much on housing because I wanted to be able to nail some of those key points. Transportation, so the poll findings have the fix it first priorities and safety first, which is also what's in our blueprint. And our region has a 400 to 500 million annual maintenance and rehabilitation gap. Our average pavement condition has declined by about 14% since 2008, with many areas slipping into poor or very poor condition. I was recently, just last week, I was out of state at a conference. And without even thinking about it, on the ride from the airport to the conference location, I thought, oh my gosh, these roads are so smooth. This is so luxurious. And that's how attuned I am to driving on some of our region's roadways where they're not as smooth. But we could have that. It's just going to take some collaboration and some work and some patience with the public. One thing I want to say to my fellow citizens in our region, yes, it can be frustrating if we're stuck in traffic or it seems like road construction is never ending. Good way to think about it is smoother roads are on the way, and those projects provide really good paying jobs to a lot of our friends and neighbors.
Yeah, definitely. Thanks, Becky. You've kind of touched on this a little bit, but I was wondering if there were any other exciting projects you see upcoming in the next 5 years, whether it is in housing or transportation that you would like to elevate.
The blueprint has projects representing every single jurisdiction in our region, which is really cool. So some of the standout projects, well, not standout, but examples of Fix It First, Stockton Boulevard corridor here in Sacramento County. They'll be doing some repaving, some bus priority, some ADA upgrades, safety improvements. Galt is going to have some complete streets project work going on for their C Street, so better lighting, crossings, better bike ped access into Old Town. Placerville is going to have a lot of corridor improvements. East Linda Gateway and Olivehurst, they're going to have a lot of sidewalks and bike lanes and drainage. So there's a lot that's been going on for housing. The Sunrise Mall redevelopment in Citrus Heights shows how a large commercial site can become mixed use. Out in Yolo County, they have a lumberyard project that's going to have some infill housing. El Dorado County is going to have some affordable housing projects in Placerville, and also their countywide affordable housing task force. So there are lots of exciting things going on. You can go onto the SACOG website and take a look at the jurisdiction highlights to see what's in the blueprint. Also see what's going on for new communities that are going to be emerging. We have this huge infill focus, and I also don't want to ignore that there are also other developments that are going to be happening in the region. Lots of good work.
Yeah, definitely. It's great to see that progress. So thank you so much, Becky. I will open it up to, I think, Q&A at this point, if that's all right with everybody. So please feel free to use the Q&A function in the Zoom screen. We have one from Bernadette Austin that we can start with. And this is, I think, directed for Alan, though.
Okay.
I'd like to hear a perspective on how we address cybersecurity fears and affordability of enterprise AI. Two of our region's largest industries are government and healthcare, which tend to have a high bar for security and privacy. These employers usually have agreements with their vendors, but they don't have a contract specifically with AI vendors to protect privacy and security. Successful AI integration appear to be in companies that can afford that with internal guardrails. So, thoughts, Alan?
Okay, yeah. So I think you kind of laid out some of the considerations in your question. The first thing I'd like, oh, dang it, the question went away. All right, well, I'll remember it. I was looking at the actual Q&A. I think the thing is it I'm glad you mentioned government and healthcare because, like you said, there's a high bar for security and things like that. And one of the things for me personally is I think a lot about the overarching nature of technology. So when I think about, regardless of whether you're communicating by email, phone, carrier pigeon, or smoke signal, there are things that are happening when you're talking to somebody else. So when I think about security for like data and stuff like that, especially in health and government, we always have to think about it like that. It kind of goes back to like this process versus technology thing. Now, as you can imagine, I kind of get iffy about cloud computing stuff and specifically you talked about AI vendors, but in healthcare and government, that's one where like cloud solutions come into place. So I'd probably say the to speak to the fears about it really goes into really kind of identifying like because I know that there are AI vendors out there because I think about some of the contracts with like the US government and things like that, but it really just comes down to isolating and like honestly like creating those agreements because I think you mentioned where how the implementation should be with companies that actually have it kind of ingrained in their processes. So I'd probably say looking at a separate AI vendor just to come in and do something, I'd be looking if AI was going to be in something with government and healthcare, it would be kind of integrated with the company that's doing it. So probably like if you had a separate thing, I'd look at it more as kind of like more on the vendor side where it's not, you don't have a separate AI vendor. The vendor who has the contracts, who has the responsibility is already integrated with that. So it's covered that way. I'm still I don't exactly. Well, no, actually, I am thinking about a lot of like the military stuff. So there is kind of like a model for that, but I think it's kind of like where who's going to cover the liability, who's going to be responsible for if something goes wrong. And so I think that's why those agreements exist. And I wouldn't see those as being with a separate vendor. I would see that as being integrated with the company. And as far as the cost, then that goes back to saying, does everything need to be cloud or service or server based? With government and healthcare, sometimes it has to be. So that's kind of my thoughts on that. I don't know how much sense that made.
Hey, Chloe.
Yep.
One thing that came to mind is Becky's a public sector representative too. And Becky, I don't know if you're positioned well to speak on behalf of SACOG about kind of how you're addressing cybersecurity in the age of AI, but do you happen to have anything you'd share from a public sector perspective?
Not from a, thank you for asking. From a cybersecurity perspective, I'm not as well versed in that aspect of it. I can talk about some of the limitations with AI and some of the work that we are doing, if that's of any interest. But I
Yes,
don't have.
please.
Sure. Okay. So a lot of people say, well, why can't you just use AI for your modeling, just as far as the different data inputs to determine, okay, if we build this project or if we do this transit expansion, how is that going to affect traffic patterns, people's ability to get from point A to point B, how long it's going to take, how is that going to affect greenhouse gas emissions? People say, well, can't you just use AI for all that? But we need actual inputs. We need data from real people, similar to what Alan was saying earlier. It's one big computer. You need to have good quality information going into that computer to have some sort of output. And yes, you can buy big data, and we use some big data as a complement to the actual data that we have from the census, from the Department of Finance, housing permit data. We combine all of that and our household travel survey data, which is a behavior-based travel survey, which is coming up. We're going to be doing it again later this year so we can get some good post-pandemic data into our model. But you need those quality inputs for AI to do what it does best. So even though it can do some of the modeling and computations for us, we still need to have the original data, and we also need to have the expertise and know-how ourselves to know, is this legit? What do we need to ground truth with this, and what's actually usable? So the appropriate use of it is critical.
Thank you so much. Okay, I'll go to our next question. Timothy Murphy, I see. What percentage of respondents said that they would switch? Of respondents who said that they currently drove, 38% said that they would be more likely to take public transit if stops were closer to their homes and destinations. And also 26% said that they would be more likely to take public transit if it took less time to travel. So those were kind of their main concerns for not using public transit right now. I am looking at our data set. We didn't look at the differences by homeowner versus renter, but we did look at differences by urbanicity. So if somebody lived in the city versus the suburb versus a small town and rural areas, one of the big differences was around safety. So let's see, 22% of rural residents said that they would use public transit more often if it felt safer, compared to 43% of city residents, urban residents. And that may just be because of accessibility concerns, but I can follow up if you have other demographic questions there. And maybe I'll go to Susan next, just because we just answered one from Bernadette. Susan asks, what are plans for disaster evacuations, and will we ever have public transportation like in Europe? Becky, do you want to take that?
So I would need to dig more into this. In this, I don't want to play the I'm new card, but I just rejoined SACOG a few months ago. But a passion of mine is emergency planning and response, given what I did before coming here. And so I'm going to be digging into that a whole lot more to find out what that looks like, because that is critical, especially with what we've seen nationally and even closer to home, like up in Paradise with Camp Fire, where there was the limited egress. And also not just people's ability to evacuate, but also for disaster and response equipment to be able to get in. So both ingress and egress are things that need to be looked at. So I don't have an answer for you today, but it is something that I'm passionate about finding out.
Thanks, Becky. It was a loaded one. Aaron, I also want to add in a question here. Just because we don't see ECE in the chat doesn't mean, it's not important. Want to focus on it too. So I know y'all just recently released your impact report, maybe yesterday, and had that webinar. Is there any other data you want to highlight for us that maybe we didn't touch on already?
I am so glad that you brought that up, but I'm still enjoying the questions because it highlights that we're all interconnected still. I mean, childcare is going to be interconnected into the systems we're talking about with Becky and Alan. I would love it if we could get the impact report posted into the chat. I sent that to Adrian. I know he'll get that in there in a second. And what everyone would see there are is information on the economic realities for our families. It'll put things into perspective. What are families who are seeking high quality childcare really working with in all the systems? You'll understand a little bit more about how investments in childcare work, and our return on investment in our county and the work that we do with Child Action and our subsidy assistance program, as well as our regional strategy and moving forward with capacity building. Some of the things I had already talked about with some city focused capacity building and high quality childcare and professional development, again, all intertwined. But I'd love for everyone to check that out because it also debuts our data tool. It is showcasing some story mapping, which there's something about maps that help people see where the greatest impact could be made, where we still have gaps. So we want to showcase all the work that we're doing through that data tool, and you can check it out at childactioninvestments.com. So hopefully that at least gets people's minds going with, ooh, what kind of childcare data is out there? Because again, it all needs to work together to have a true impact in our county.
Yeah, thank you so much, Erin. I can't wait to read more in that. And yes, I do see it in the
Thank
chat.
you.
Thank you, Adrian. Okay.
Thanks so much.
Yeah. We have one last question in the Q&A bit from Bernadette again. So we've made progress in our region on housing and policy advancements. It seems like the costs of supplies, labor, might be the kind of key barrier. So what can we do as a region to address those cost issues?
Bernadette, I'm glad you asked because this was one of my key points that I wanted to talk about in the first part of this. So thank you for teeing that up for me. So yes, absolutely. The costs of implementing these projects, delivering these projects limits. She said, happy to give you a layup. That's awesome. Definitely limits purchasing power and the ability to stay within budget. So even as some of the material prices may stabilize, labor construction costs could remain elevated. So the regions, transit districts, developers, everybody has to stretch those dollars further. So that definitely reinforces the value of focusing on what's most critical. If it's something that's safety related, yes, we want to prioritize that. Transportation, looking at pavement and bridge preservation, transit priority and operational improvements, coordinating any type of housing and infrastructure investments that we do. And also looking at the fact that innovation is going to be more about integration and looking for those collaborative efforts like what HealthNet's been doing with SACOG and what Adventist was doing in the Sutter area, and more of these public-private partnerships and looking at those shared goals. Another complexity with all that is the Federal Surface Transportation Bill. Under its current law, expires in late 2026. And historically, reauthorizations have been uncertain, they're delayed. So that puts a lot of pressure on the local communities to prioritize existing infrastructure and look at projects that are ready to go and that are cost effective and also have some really clear outcomes tied to safety, maintenance, access, whatever's most critical to those communities. More than ever, we're going to need to collaborate. One thing I love about the Sacramento region is even though we're this major metropolitan area, it's still this small community where the people who have the ability to make decisions and make things happen, a lot of times they know each other, or they're only 1 or 2 degrees of separation away from each other. So it's a matter of keeping those conversations open. I was just on a call a couple of days ago with other local government, quasi-government, state government entities, and we were just sharing information of here's what I have going on, here's some of the challenges. And somebody said, oh, I can help you with that. Oh, send me this. And we might be just having those really open and honest, here's what's going on, I need help with this, and somebody has the answers. So, and I know that sounds really Pollyanna and optimistic, but it's how things happen, especially here in the Sacramento region, like nowhere else. And Erin earlier talked about the interconnectedness of the work that she's doing. I can corroborate that just looking at how much healthcare is tied in with transportation and housing. Transportation, it was a little more obvious at first when you think about people's access to healthcare or certain types of transportation modes emit more into the atmosphere that causes, ill effects from air quality, ozone and NOx and everything else, PM. That's a little bit more obvious. Some of those connections aren't as obvious, but this is all interwoven. And I like to think of what we have here in the Sacramento region. When we work together, the whole is greater than the sum of its parts with everything that we do. And so we're going to need to be innovative. And especially when it comes to public funding, because a lot of times different buckets are so restrictive with how you can send it. Okay, there's all this money for this. Oh, but that's only for capital and we need it for O&M. Or, oh, this is only focused on this, but we need it for that. So are there some funding swaps that you can do? Is there anything you can fast track? So yeah, it's all about communication and collaboration and being innovative, bundling projects, bundling work wherever possible.
Yeah, thanks so much, Becky. And that reminds me of something that I've talked about with Child Action too, right? It's like if we think that the state is going to solve all of our problems with childcare, like we are so wrong. And it's really the partnerships we have to build and working with, yeah, our employers as well for that sector. So thank
And
you.
one more quick
Yeah.
thing. I know I rambled on a little bit about
No.
that. Also, to Alan's point, where Alan was saying he's an old school engineer, a lot of times that's also what it takes, laying stuff out. Sometimes, and Aaron was talking about the value of maps, lay it all out, put things up on a wall and go, okay, here's what we're thinking of doing. And then people iterate and build on it. And then getting the different interests in the room to talk about the ideas, that's also not just where you're going to discover commonalities, shared priorities. You're also going to uncover the unintended consequences, because that's a reality for everything that we're doing as well.
Thanks for the shout out.
Well, I think we are out of the Q&A from the audience, but Adrian, I know you have a burning question you would like to ask everyone, so I'll kick it to you.
Yeah, this is my favorite question to ask. Thanks, Chloe. And it's for each of the panelists. What is one bold prediction that you have for your sector 10 years from now?
Does anyone?
Well,
Ellen?
you can go first. You can go first. That's
Oh, okay. All families and children in Sacramento County are being served when they need high quality childcare. They get it. We have partnered with enough. We have enough funding. We don't have anyone waiting on an eligibility list. Everyone who's eligible is being served. And if we're still in this eligibility world in 10 years, you're still going to get a service as far as the quality care you need when you're 0 to 5, and we also serve up to 0 to 13. So all children are being served by Child Action and know who Child Action is.
Thanks, Aaron. Alan, do you want to go next?
okay. There we go. Yeah. I'd probably say, especially if we're 10 years out, I'm looking for some type of correction. I think like if you look at like the cost of specifically like hard drives, RAM, all this stuff, you look at some of like the comments made. I think all I'm going to do is whine about the billionaires. But when you look at and also you have like the Strait of Hormuz stuff and all that and stuff like that. But I'm not all doom and gloom when it comes to AI, but I do think that there's kind of a bubble aspect to it. And we've done pretty good so far, but I feel like the bill's coming due as far as like what this is actually doing. So if you look at stuff like OpenAI and all their funding stuff, and then now like I think call it the Claude Code stuff. So I think I'm looking for some sort of correction. It still feels like kind of like the fear of missing out. So you're gonna need like a crash or at least enough like oopsies where people start to kind of go with it. I don't think that it's gonna go to the dustbin, but we're gonna need some and a repeat of lessons that we've learned before it really sits down, because that's the only way that people are going to learn. It's too easy to jump in and do something. So until we get enough cracks to where people kind of dial that back. So that's what I'd say. Hopefully in 10 years, enough of those have happened enough, and hopefully not at too much of a damage to the society at large.
Thanks, Alan. Becky?
So the question was a bold prediction, or is it more a hopeful outcome?
He said bold prediction.
Bold prediction. Well, I'm hoping that I'm confident that we're going to be delivering on the outcomes that we hope to achieve from Blueprint. We have some really good collaboration going on right now. We are not without our challenges, for sure. With collaboration, we can definitely chip away at this and provide more options for people. So they're not forced into, I have to live here because it's my only option, giving people some freedom with where they live and how they get to where they want to go, and have more safe ways of taking non-motorized options. How much would you love to be able to ride your bike to the farmer's market or walk to your grocery store? I live within easy walking distance of a few stores, but it doesn't feel safe to walk there. Just there's a lack of continuity with the safe way to be able to do that. And just closing some of those gaps that are those barriers. And some of them they're not insurmountable. It's just a matter of prioritizing them. And I do want to put in a plug for something else we're doing this year, because one of my other bold predictions or hopes for the next 10 years is reducing the rate of serious injury and fatalities on the roadways. We are going to be focusing our regional monitoring year-end report for 2026 on safety. So more to come on that.
Very exciting, very bold. Thank you all for joining us. I think, if we don't have any other questions, we'll probably close here. Thanks, Adrian. So if you have any other questions about the polling data that we've shared, our report is now published on our website, so please feel free to check that out. If you want any questions that I can direct to our speakers as well, please feel free to email me. My email's on that slide. Thank you all for joining us. And a huge thank you to our speakers as well.
Thank you,
Thanks,
Chris.
Thank you, Chloe. Thank
Yeah,
you.
thanks for having us.
Thank you.
Bye all.
Bye.